Hi, my name is Allie Froscino. I'm a dietetic intern with Sage. For our weight loss patient, I named her EC for her initials, for example client. I put her date of birth, I made up a date of birth that made her 41 years old because that is what it said in the document that we received. For her food and nutrition related history, she had obesity in her family, but she does not smoke and she does drink occasionally. She had 2 children who are now teenagers, and she's gained 40 to 50 pounds with each pregnancy, which is a high amount of weight gain for a pregnancy. She is not physically active. She reports that a lot of her struggle is that her children only like junk food, so it makes it hard for her to cook healthy meals. So something we can look at in counseling her might be ways to make healthy meals that seem like they're kind of junk food, or comfort foods that are lightened up a little bit so that her children will eat them too. She has attempted to lose weight before, but she was not successful, and she has no known food allergies. I did an analysis on her diet recall and found that her current intake is around 2,500 calories per day. So for the physical assessment, she does appear to be well nourished, but she does say that she feels tired. Her blood pressure is a little bit high, and her waist circumference is also high. She's 41 years old, she's a female, and she's 5'6", which at 178 pounds, that puts her at a BMI of 28.7, which classifies her as overweight, and even a little bit on the high side of overweight. She's nearing obesity a little bit. Her ideal body weight is 130 pounds, plus or minus 10%, and I based that on the Hamway formula. However, when I did her nutritional needs, I used the plus 10% just to make it not be too drastic for her. I based everything off of 143 pounds, which would be 10% more than the 130, because she is at 178 now, so we want to do a gradual weight loss and not have anything too daunting. As far as her weight history goes, she gained 38 pounds over 20 years, which is a 29% gain, which is pretty significant, even though 20 years is kind of a long time. Her labs, she is high in glucose, low in HDL, and high in triglycerides. The glucose, she could maybe fix this with weight loss, since that's one of the main interventions for prediabetes. If she's started to see more symptoms of diabetes, or if she were to get her hemoglobin A1C tested and found that she was diabetic, then this might change, but it seems as though she might just have a little bit of elevated glucose right now, which might be able to be adjusted with weight loss. And the weight loss would also help to improve her lipid profile, especially when she starts eating a more healthful diet. As far as her past medical history goes, she has 2 children. I put gravida 2, para 2, but to confirm that with the patient, because there were no other pregnancies mentioned, but we can't be completely sure. Both of her children were very large. They were both just around 9 pounds, and she has no other significant medical history. She is not on any medications, just a 1-a-day multivitamin, so she's a pretty simple case. It makes it a little bit easier to help her lose weight since she doesn't have anything else really going on. So I estimated her nutritional needs based on 65 kilograms, so that is from the ideal body weight of 143 pounds. Like I said, I don't want to dip her too low. For her calories, that I did 25 calories per kilogram, which is based on her ideal body weight, and that gave her 1,625 calories a day. For her protein, I went a little bit higher since she's trying to lose weight, and I put her at 1 gram per kilogram, which is 65 grams a day. And for fluid, she would be at 1625 milliliters a day with 1 milliliter per kilogram. So for her nutrition diagnosis, the first one and the main one that I focused on was excessive energy intake related to consumption of energy-dense foods, as evidenced by intake of 156% of her estimated energy needs, and a weight gain of 29% over the last 20 years. For the other problem, I did a clinical one. I know that we're supposed to focus on intake, but I thought that this was very relevant for her. I said overweight, related to overconsumption of energy, as evidenced by the BMI of 28.7, and that her current weight is 137% of her ideal body weight. So for her nutrition prescription, for her intervention, I gave the nutrition prescription of the lowered calories, the protein, and the water requirements. And I recommend a generally healthful diet. I want to work with her on goal setting and self-monitoring and cognitive restructuring to try to get her to start working around her children and starting to work towards getting a healthier diet and helping her lose weight. So for my monitoring indicators, I did weight, and the criteria for that was that I want her to lose 1 to 2 pounds per week, no more. So for her 5-week weight goal, I'm basing that on 1 pound a week. By the 14th of February, we would want her to be 173 pounds. So I thought that was a good, smart goal for her. It seems pretty attainable. For her diet recall, we want to make sure she's consuming around the 1625 calories a day. I want to get her blood pressure down to 120/80, although that might not be influenced right away by the change in nutrition. I just want to include that just to keep monitoring it, to make sure that she's okay and she'll be okay on this regimen. And we want to make sure that she doesn't actually end up with hypertension, because then we'd have to add in some salt recommendations as well. And for her biomedical data, I want to make sure that she has no nutrient deficiencies, because I want to make sure she's doing this the right way and that she will still remain healthy and well nourished while losing weight. And I signed off on it, and I did not have my preceptor sign off on it since I didn't do it there. But that is it. Thank you so much.